Welcome back and thank you for keeping it TV47. This is Body Garage with I, Sheila Chelangat, where on this episode we are focusing on kidney infections, and taking us through it is Dr. Hussein Bagha. Thank you, Daktari, for keeping it TV47 and being with us on this particular episode as well. Before the break, we did touch on, some of the complications if kidney infections are left untreated, and you mentioned kidney cysts.
No, so as I mentioned, that kidney cysts can predispose you to getting kidney infections, because cysts are just like balloon-shaped structures that develop within the kidneys. And sometimes if they're communicating with the urinary system, then they can cause problems. The cysts themselves can get infected as well because they don't have a good blood supply, so it becomes very difficult to treat those cysts that are infected, and sometimes you actually have to surgically remove them as well.
All right, thank you for that clarification. Now I'm wondering, can I prevent kidney infections?
Yes, so the most important thing, as I mentioned, is not to get the urine infections or the urinary tract infections, especially the ones found in the bladder or the urethra. And as you rightfully mentioned, that females, especially younger females, are more prone to getting urine infections. And as I mentioned, one of the ways is making sure that you keep yourself well hydrated, making sure that you pee regularly, don't hold back. I mean, as I mentioned, what some of the reasons why people do that. And then, of course, if you develop any symptoms of the urinary tract infections, like if you develop any burning sensation, or if you find that you're going to pee more frequently than normal, then you need to see your doctor immediately so that they can take care of that urine infection before it ascends to the kidneys. However, if you develop flank pain and you develop fevers, you develop nausea, vomiting, then you need to come to the hospital immediately, and so that your doctors can check you out and then carry out the necessary tests and then treat the infections appropriately.
You have emphasized the need to be well hydrated.
Yes.
How much water should someone take for them to be well hydrated?
So ideally, you should take between 2 to 2.5 liters of water in 24 hours. Of course, if you're living in a very hot and an arid environment, then it goes higher. And that is very important, because among the things that the water also helps you with is to prevent the formation of kidney stones, especially if you're living in very hot areas like northeastern or coast, where we find a lot of prevalence of kidney stones as well. And the kidney stones do predispose you to developing kidney infections. So that's very important.
Okay. And can the color of my pee actually notify me that there's something wrong, that you perhaps are getting a kidney infection?
So if you tend to see any blood in the urine, then that's a red flag that you need to get checked immediately. If you find that the urine has got a bad odor as well, that also might be a red flag as well, and you need to get that checked out as well. If you find that your pee is getting very yellow, it's most likely because you're getting dehydrated. So you realize that as you take a lot more water, the pee becomes more clear.
All right, thank you for that, Doctor. I'm sure most people sometimes think that pee should be yellow in color.
Yeah, ideally it should be very light yellow to clear, not dark yellow, because that would suggest that either it's getting concentrated, or sometimes it could suggest liver problems, but that's a bit rare. Yeah.
And after treatment from the kidney infections, is there a possibility of it recurring, and what causes the kidney infections to recur?
So if it's treated appropriately with the right antibiotic for the right duration of time, then it shouldn't recur. So it can recur, especially if you have any structural problems within the urinary tract, like obstruction, or you have a prostate that is enlarged, or you have a stricture. So that can make it recur. So that is why if somebody is getting recurrent urinary tract infection, then we do further tests like imaging, the ultrasound, to check for any obstructions. The other thing is, of course, if the patient becomes non-compliant to medications, and if they don't complete the course of the antibiotics, then it can predispose you to getting a recurrent infection, because that will not be totally cleared out. Yeah.
And how long does it take for one to recover after getting an infection?
So again, it depends on the the severity of the infection, because normally for kidney infections we normally treat for between 7 to 14 days depending on the severity and the type of bacteria that you find as well. Yeah.
All right, let's get to kidney care, Daktari. Are there foods that are good for my kidneys?
So what you need to understand is there's no one particular food that is good for the kidney. What you need to do is to eat a balanced diet. So there are these 8 golden rules that we have come up with, that the World Kidney Day in collaboration with the ISN has come up with to keep your kidneys healthy. And among the 8 golden rules, one of them is a healthy diet.
Yes.
A well-balanced diet. So everything in moderation. Of course, you have your half of your plate is with vegetables, and the other half you divide it into 2 into proteins and carbs, and everything is in moderation. Of course, you try to avoid the red meat, you try to avoid too much of fatty foods, you try to avoid the fried foods. So eat more of white meat like chicken and fish. So those are the things that we normally tend to talk about when it comes to a balanced and a healthy diet.
Yes.
Yeah.
And how long would you recommend for a person to go for checks? Are they necessary in the first place?
So without checking, you can never know if your kidneys are okay or not. So unfortunately for kidney disease, the symptoms and the signs come in much late.
Yes.
By that time, it's a bit too late to do anything. So if you are at risk for kidney disease, like for example, if you have diabetes, if you have high blood pressure or hypertension, if you are obese, if you have a family history of kidney disease, if you had developed kidney injury in the past for whatever reason, either because of an infection or for females during pregnancy, then it's very important that you have regular checkups done. And you should ask your doctor, if your doctor is not doing them, that look, I want my kidneys to be checked. And it's very simple, because we do a urine test and we do a blood test for the kidney function. And if that is abnormal, then they will refer to the kidney specialist.
You've mentioned a couple of diseases for people who should take note if they have the diseases to sort of go for the checks. And let's begin with diabetes. How does diabetes affect my kidneys?
So what diabetes does, diabetes is basically a condition whereby your body is not able to process the excess sugar. And so that sugar ends up being in the blood for much longer periods of time. And that causes damage to all the organs, including the heart, including the brain, the liver. So the kidney is also one of them as well. So what it does is that it basically damages the blood vessels of all these organs, including the ones in the kidney. And eventually it leads to kidney failure as well. As the sugar is deposited within the blood vessels, it leads to damage to the blood vessels, and the blood vessels become narrower. It also leads to inflammation within the kidney as well, and this leads to further damage to the kidney. Yeah.
Okay, you've mentioned sugars, and let me take you back to the foods. You've mentioned that we should have, balanced diet. There's at least leafy, vegetables in your diet. But then there are people who say that excess leafy, components in your diet also is not so good for your kidney. Is that it, Doctor?
No, so if you already have kidney disease, pre-existing kidney disease, then of course you're on a kidney diet. So the kidney diet, then you have to see a nutritionist so that they can give you a whole list of items which you can reduce. Because remember, the kidneys are important in terms of taking care of your electrolytes, in terms of taking care of the excess toxins. So for patients with kidney disease, your phosphates are very high, your potassiums tend to go up. Now your green leafy vegetables tend to have very high phosphates in them, so you need to leach them and reduce the amount of the green leafy vegetables in your diet. For the potassiums, of course, then you have to reduce the amount of bananas you take, the avocados you take, and so on and so forth. So it depends on whether you have chronic kidney disease or not. Of course, as I mentioned earlier, everything, even when you're not having kidney disease, everything has to be in moderation as well. Yeah.
Okay. And what, away from that, what are the risks of having an untreated kidney infection, especially when someone is pregnant or expecting?
So that's a very important question, because sometimes it does happen. Pregnant women do tend to get urine infections very commonly. a lot of times they may not even have the symptoms of the urine infection. And any infection in a lady who is pregnant can predispose premature labor and delivery. So that's one thing that we have to be very cognizant of that. And that is why if you ask the gynecologists who take care of the pregnant ladies, they normally ask for urine tests every so often. Of course, if it's left untreated, it can also ascend and cause a kidney infection. And that can also be quite dangerous as well, because it can precipitate labor as well and premature deliveries as well. And then, of course, it does damage the mother's health. So that has to be taken care of immediately. When a lady gets any kidney infection, then we have to treat it immediately without delay.
But can it also affect the baby's health?
So, of course, any infection in the mother can lead to effects on the baby as well. So, not directly, but what happens is when the mother gets sick, then she's not able to eat, she's vomiting, she gets dehydrated, it can precipitate labor as well. So, all of these do have negative effects on the baby.
And oftentimes when one gets an infection, the first thing they would do is get, over-the-counter drugs and self-medicate. What is the impact of, self-medication to the kidneys?
So one is that I would request all the viewers never to do that. What happens is you don't know whether it's a true infection or not. So if you just get antibiotics over the counter, one is that you don't know whether it is appropriate antibiotic. If you do have an infection, you might develop resistance to the antibiotics, especially if you're not taking the right antibiotic, the right dose for the right duration. It can make the infection worse as well, especially if you are not treating it adequately. Sometimes some of these medications can cause kidney damage as well. So you have to be aware about that fact. And it's important to get checked by qualified doctors so that they can treat it appropriately. If need be, we do the cultures and then subsequently give you the appropriate antibiotics.
Could you touch on, the sepsis bit? How does, these infections cause sort of this blood poisoning?
So if you have an infection in any organ and if it's not treated, then the infection spreads, and all organs are basically being supplied by blood vessels. So these bacteria then subsequently get translocated into the blood vessels and they become systemic. And when that happens, now you develop sepsis. And of course, if left unchecked, it can lead to septic shock, whereby now your blood pressure tends to go low, you end up being transferred to the critical care units, and it can be fatal.
And for someone who now is living with these kidney infections, how would you advise them to, take care of themselves?
So if you have a kidney infection, or if you suspect you have a kidney infection, please come and see your doctor immediately. Okay, because all infections, you can treat them. And for people who get recurrent infections and they don't have any structural problems, then we basically put them on prophylaxis or prophylactic antibiotics. Of course, that has to be done under the supervision of a nephrologist who has enough experience about treating recurrent urinary tract infections. And of course, now, even when you have an infection, you are still advised to drink a lot of water, because every time, remember, when you are peeing, you're flushing out the bacteria from the urinary tract. So that is very, very important still. And then please complete your antibiotic course. Don't leave it halfway because you're feeling better. Come back for a checkup to make sure that the infection has cleared up.
How long should someone take the antibiotics?
As I mentioned earlier, it depends on the severity of the infection, the type of bacteria. It's normally between 7 to 14 days, but it has to be determined by your doctor who is treating you. Whether it's going to be 7 days, whether it's going to be 10 days or 14 days.
All right.
Yeah.
Thank you very much, Daktari. We are up for our second commercial break. Do not go too far. Keep it TV 47.